Hi, my name is Dr. Megan Fay, and today I'm going to be talking to you about misophonia. Welcome back to the second video in my series on misophonia. I'm a licensed psychologist who specializes in the treatment of misophonia. In the first video, I covered an overview of what misophonia is and how many of the most common psychological features present. In today's video, I'll provide an overview of how to pursue assessment with different specialists in order to find out if your experience of sound sensitivity is due to misophonia, an audiological condition, a medical condition, a sensory processing concern, or a different psychological diagnosis. As a review, misophonia is a psychological condition that includes intolerance of certain sounds, which is usually dependent upon who is generating the sound or the situation the sound is occurring in, and is typically accompanied by strong feelings of anger or agitation. When seeking assessment to determine whether you have misophonia, an important thing to keep in mind is that misophonia is a diagnosis of exclusion. This means that we want to first make sure you're not experiencing a medical or structural reason for your sensitivity to sounds, meaning the way your ears or your brain are receiving those sounds. We also want to rule out other psychological conditions that could explain sound sensitivities. Misophonia is usually diagnosed once these other areas are ruled out. This is important because the diagnosis you receive will determine what is the most helpful treatment for you. For instance, an audiological origin of sound sensitivity will have a different treatment from a psychological origin of sound sensitivity. An invaluable first step in the assessment process is to receive an audiological evaluation. It can be most helpful to find an audiologist who has experience with misophonia. However, looking for audiologists with expertise in tinnitus is often another way to find someone who's familiar with misophonia or another commonly confused diagnosis, hyperacusis. Hyperacusis is an audiological diagnosis that looks very similar to misophonia. Hyperacusis is a condition where a person experiences all sounds within a certain amplitude or range as triggering. This is likely due to how your audiological system is processing sounds and can often be treated with audiological tools used to treat tinnitus. For example, a person with hyperacusis would typically be bothered by all chewing sounds of a certain sound range, whereas a person with misophonia could hear the same sound made by two different people and only react to one. This is the key element that makes misophonia psychological rather than strictly medical or structural, although people can certainly experience both. Another important step in your assessment journey is to meet with a physician to rule out other medical concerns. For instance, an ear, nose, and throat specialist or a neurologist can help understand if something related to the brain or body is causing that sound sensitivity. One example of a neurological source could be a history of concussion. Another great assessment resource is to meet with an occupational therapist to receive assessment for sensory processing disorder. People with sensory processing disorder often experience sensory information differently due to the way their systems interpret the sensory information. This sensitivity may extend to other sensory experiences beyond sound, such as a sensitivity to touch and textures. Sensory processing disorder is not a psychological disorder, so it is not typically diagnosed or treated by a mental health professional. A sensory processing concern can look similar to misophonia. It can be worth exploring occupational therapy as an avenue for treatment, as this treatment can include experiential interventions that aid with sensory sensitivities. Finally, a last step to consider before arriving at a misophonia diagnosis is to rule out other psychological conditions that include sound sensitivities as a symptom. For example, many people with autism spectrum disorder experience sensitivities and emotional reactions to sounds. Another example of a diagnosis with sound sensitivity is post-traumatic stress disorder, which can include strong responses to triggers and hypervigilance for these triggers, including sounds, that are associated with the trauma. This is by no means a comprehensive list of psychological diagnoses that include sound sensitivity. Meeting with a mental health provider for a comprehensive assessment can help determine the most appropriate diagnosis for your symptoms. Once you've determined that you have misophonia, the next question becomes, how do you find a treatment provider? I recommend looking for a mental health provider who has expertise in cognitive behavioral therapy or acceptance and commitment therapy, as these are interventions that are evidence-based treatment for obsessive compulsive disorders, which is how misophonia is currently classified and frequently treated. A mental health provider who is also well-versed in dialectical behavior therapy can also be very helpful, as these tools can help with regulating the anger and distress response to sound triggers, as well as can improve interpersonal relationships that are impacted by misophonia. Thanks for tuning in. Check back soon for the next video in my series where I'll begin diving into how tools from these different treatment interventions can be applied with misophonia. If you've enjoyed this video, please rate and subscribe.